Hello, I'm Mirha Qadir, class of 2021. I am getting the certificate in global health and was able to complete an internship at Albert Einstein College of Medicine in Montefiore Hospital in the Bronx, New York. So unfortunately, I couldn't go there in person due to COVID-19, but um, I was able to have a virtual internship experience with Dr. David Lounsbury, who is an assistant professor of epidemiology and population studies at Albert Einstein, and who also conducts research as well. So I made a PowerPoint that I will share now. So here I have the a PowerPoint that I made for my internship. As I said, it was at Albert Einstein College of Medicine / Montefiore, and it was with Dr. Lounsbury. So one of the main projects that I worked on was the African oncology settings paper. So essentially, Dr. Lounsbury and some of his colleagues in African countries had conducted a study on physician-patient communication and how the dynamics of an oncologist delivering bad news to a patient work, and what physicians might be able to do to improve that sort of communication, which would then improve health outcomes. So the data had already been gathered, and I essentially worked on conducting a mini literature review and drafting the manuscript intro section. So I mainly did a lot of my own research through databases like PubMed on various sociocultural factors that go into physician-patient communication. And I found very interesting things about how culturally incompetent communication can be perceived as bad news to some patients. So there was one study conducted in South Africa a few years ago that showed that South African citizens of African origin seeing white providers perceived treatment options such as like chemotherapy as culturally incompetent in some settings because of cultural factors. So to a physician, that wouldn't seem like something that was bad news. It would seem like something that was good news, but the way they communicate it does not respect sort of cultural values that those patients have. So they perceive it as bad news, and that definitely is a barrier to effective communication. So interventions can range from sort of training physicians on how to provide that culturally competent care, or more long-term restructuring of medical school curriculum to include things like social determinants of health and cultural aspects of the way people navigate healthcare. So there's that. And then the second main project that I worked on over the summer was something called system dynamics and group modeling. So Dr. Lounsbury and his colleagues had conducted sort of seminars in Hartford, Connecticut around HIV related care. So basically they had these sort of model building sessions to build a model that shows the various aspects that go into providing care, such as transportation, income, other social determinants of health, as well as more biological determinants of health. So there was some virology, there was some epidemiology, and sort of sociology involved in that. So basically what had happened was they got people ranging from community health workers to physicians to nurse practitioners to people who have more managerial roles in nonprofits geared to serving the AIDS community in the greater Hartford area. And I transcribed interviews that Dr. Lounsbury conducted with study participants who had that role in helping build that model. So for me, oh, and also after that, I qualitatively coded the interviews that I transcribed in a software called In Vivo, which was also a very interesting experience for me. I learned how to qualitatively code as well as use a new software, so that was exciting. So through that, I think I got a really good idea of how research is conducted, a more hands-on sort of way, and how it can be conducted in virtual settings, such as virtual interviews. And I think what really is going to stick with me is just how vastly different people's perspectives can be, or different providers' perspectives can be, like the perspective of a nursing assistant versus a community health worker versus a physician. They are going to be vastly different, and they are going to think of different solutions to the same problem. So that is why something like system dynamics and group model building together in collaboration is so important. And then these are just some pictures of my summer. I went on hikes with my family in my downtime, spent time with my dog, who's a black Labradoodle, and in my personal community, and you see me wearing the GHP mask that we all received, I spent time shadowing a physician who worked as a gastroenterologist in my local community to sort of supplement the knowledge that I gained from my internship about how physician-patient communication works. And I got to sort of observe it in a real-time setting. So I'm very grateful for that as well. And yeah, that was my summer. Thank you very much for listening. And again, I'm very grateful to the Global Health Department for funding and just generally for helping me get to where I am and helping me get to this opportunity to be able to do this virtual internship during this unprecedented summer. So thank you.